younger, but you don't want to look like you've had something done? Well, Dr. Bill Johnson of Innovations Medical knows the latest techniques and tools to help your face look younger, but still look like you. Good morning, Dr. Bill.
Good morning.
That is a big fear. I think people do have this concern about going in for any type of procedure, fearing that they might come out without even being recognizable. But I wanted to start off by talking about the changes that we experience in our face. What is it that causes those?
Well, there's really three things that are going on as we age in our face. The first is collagen loss, and here's a good example of what happens when we lose collagen. You see the sagging, you see the crepey appearance of the skin. All that can be corrected. You can pull that up and improve that sagginess and that crepey appearance.
That's a dramatic difference.
Dramatic difference. So second thing is muscular action, and the muscular action causes the forehead wrinkles in particular, also causes some wrinkles around our eyes, and again, these things can be corrected.
Wow.
You make a real difference with correcting just muscular action.
Right, and it doesn't transform her face to the point where you don't recognize who she is. It just almost gives her kind of just a fresh look.
Here around the eyes with the famous crow's feet.
Right.
And again, when you correct that, you can make a real difference, and it just makes you look younger, better. And then the most important one that people really start to kind of realize is loss of volume in the form of fat. And when we do that, especially in our lower face and around our cheeks,
that really shows age.
You can see a real difference in when it happens when we restore that. So those are really the three factors that are most important.
So let's talk about what you can do to help offset this collagen loss.
Well, collagen loss, first thing to think about is prevention. And 95% of it is caused by sun damage. So wearing a sunblock and wearing a hat are really important features. But all of us pretty much peak when we're about age 20, and from a collagen standpoint, it's all downhill from there.
Wow.
So
a little depressing.
Yeah, it is a depressing thought. So Thermage, which we're seeing an animation of how it works, is a really great tool for restoring collagen. It uses radio frequency heating to cause your skin to contract initially, so we see some initial response, and then over time your body responds to that by laying down large amounts of new collagen. And that first picture that we saw, this is a before and after of a Thermage patient that really makes a big difference in how the skin looks.
All right, well, do you ever add anything to the Thermage to kind of add to the collagen component?
Yeah, a lot of folks like to use a resurfacing laser, and we do that because resurfacing lasers do just that. They create a new surface on your skin, so they're kind of the ultimate exfoliant, and they produce a large amount of new collagen as well, and they're great for the fine wrinkles and great for pigmented areas, the age spots that we get. And the resurfacing lasers are real nice nowadays because there are several of them out there, and so you can kind of dial in and choose how much downtime do you want, how much new collagen do you want by choosing which laser you use.
Oh, okay, so you have some options there.
You have some real options.
But what about the muscular component? What can we do to the effects of muscular deterioration?
Well, the muscular component is Botox. That's really the king. And Botox does a great job of relaxing the muscle and releasing that muscular contraction that causes the crow's feet, that causes the lines on the forehead. And when done properly, we don't get the frozen look anymore.
Right.
That was real popular 10 years ago. But nowadays, Botox can be done properly and without it really showing that you've had it.
Well, and we are out of time. I do want to show, as we're doing to the tag, you can see how small this needle is. It's a little less intimidating when you're looking at it here. But I also want to let people know that for more information, you can log on to innovationsmedical.com, or you can call the Dallas location at 214-420-7970, or the Fort Worth location at 817-744-7901 for a consultation. And of course, if you have a question for Dr. Bill Johnson, you can drop him an email at questions@innovationsmedical.com. As always, great information. Thank you so much for being here. Okay, Chris, over to you.